Welcome. Today we're diving deep into a challenging and often misunderstood lung disease, cryptogenic fibrosing alveolitis, or CFA. Also known as idiopathic pulmonary fibrosis, or IPF, it's a chronic and progressive condition that scars the lungs, making it difficult to breathe. We'll explore what it is, what causes it, how it's diagnosed, and what treatment options are available. Join us as we unravel the complexities of this serious respiratory illness. The term cryptogenic means of unknown origin. This is at the heart of CFA, its exact cause remains a mystery. While we don't know the precise trigger, research suggests a combination of genetic predisposition and environmental factors likely play a role. Potential culprits include exposure to environmental pollutants, certain viral infections, chronic microaspiration, and even genetic mutations that predispose individuals to lung damage. Smoking is a well-established risk factor and significantly increases the likelihood of developing CFA. Understanding these risk factors is key to ongoing research aimed at uncovering the root cause. Let's talk about what's actually happening inside the lungs of someone with CFA. The disease primarily affects the alveoli, the tiny air sacs where oxygen is exchanged with carbon dioxide. In CFA, these alveoli become inflamed and damaged. This initial injury triggers an abnormal healing process. Instead of repairing normally, the body lays down excessive scar tissue, a process known as fibrosis. Over time, this scar tissue thickens and stiffens the lung tissue, making it harder for the lungs to expand and contract. This reduced lung compliance leads to impaired gas exchange, meaning less oxygen gets into the bloodstream and carbon dioxide builds up. The result is shortness of breath and other respiratory complications. CFA is a relatively uncommon disease affecting an estimated 30 to 20 people per 100,000 worldwide. It primarily affects older adults, typically between the ages of 50 and 70. Men are more likely to be diagnosed with CFA than women. While CFA occurs globally, prevalence rates can vary slightly depending on geographic location and population demographics. It's important to remember that these are just estimates, and the true prevalence of CFA may be higher due to underdiagnosis or misdiagnosis. The symptoms of CFA can develop gradually, often making it difficult to recognize in its early stages. The most common symptom is shortness of breath, particularly during exertion. This can start as mild breathlessness during exercise, but progressively worsens over time. Other symptoms include a persistent dry cough, fatigue, unexplained weight loss, and clubbing of the fingers and toes, a physical change in the shape of the fingertips or toes due to chronic low oxygen levels. It's crucial to consult a doctor if you experience any of these symptoms, especially if you're at risk for lung disease. Diagnosing CFA can be challenging as its symptoms can mimic those of other lung conditions. The diagnostic process typically involves a combination of medical history, physical examination, and various tests. A doctor will listen to the lungs for characteristic crackling sounds, often described as Velcro crackles. Imaging tests such as a high-resolution CT scan of the chest are essential for visualizing the lung tissue and identifying patterns consistent with CFA. Pulmonary function tests measure lung capacity and airflow, providing valuable information about lung function. In some cases, a lung biopsy may be necessary to confirm the diagnosis. This involves taking a small sample of lung tissue for microscopic examination. While cryptogenic fibrosing alveolitis, or idiopathic pulmonary fibrosis, is generally considered a single entity, there are some classifications based on disease progression and severity. These classifications help doctors assess the disease's impact on a patient's life and tailor treatment accordingly. Disease severity can be graded as mild, moderate, or severe, based on pulmonary function test results and the extent of scarring seen on CT scans. Additionally, disease progression can be classified as stable, slowly progressive, or rapidly progressive. These classifications can help in predicting a patient's prognosis and guiding treatment decisions. It's important to note that these classifications are not strict categories, and a patient's disease can change over time. Currently, there is no cure for CFA, but treatments are available to help manage symptoms and slow disease progression. The main goals of treatment are to improve quality of life, reduce symptoms, and prolong survival. Antifibrotic medications, such as pirfenidone and nintedanib, have been shown to slow the rate of lung function decline. Pulmonary rehabilitation programs can help patients improve their breathing and exercise tolerance. Oxygen therapy may be prescribed to alleviate shortness of breath and improve oxygen levels in the blood. In advanced cases, lung transplantation may be considered as a treatment option. Supportive care, including managing cough and other symptoms, is also an important part of treatment. Because the exact cause of CFA is unknown, there is no definitive way to prevent it. However, certain lifestyle choices can reduce the risk of developing the disease. The most important step is to avoid smoking, as smoking is a major risk factor for CFA and other lung diseases. Minimize exposure to environmental pollutants such as dust, fumes, and chemicals. If you have a family history of lung disease, talk to your doctor about genetic screening. Maintaining a healthy lifestyle, including regular exercise and a balanced diet, can also help support lung health. The prognosis for CFA varies from person to person, but it is generally considered a serious and life-limiting condition. The average survival time after diagnosis is typically between 3 and 5 years. However, some individuals may live longer, while others may experience more rapid disease progression. Ongoing research is focused on identifying new therapeutic targets and developing more effective treatments for CFA. Recent advances include the development of new antifibrotic medications and the exploration of potential biomarkers for early diagnosis and disease monitoring. Clinical trials are also underway to evaluate novel therapies, such as stem cell therapy and gene therapy. These advances offer hope for improving the lives of people living with CFA.